Hi, I'm Dr. Swati Kanakia, Pediatric Hematologist-Oncologist from Mumbai. If you have chosen to see this video, it means that you've received a report or a phone call from the laboratory saying that your child's platelet count is low and you are understandably concerned and worried. But wait, let me take you through the causes for a low platelet count or thrombocytopenia. So what are the causes of thrombocytopenia or low platelet count? The commonest cause is infection, a viral fever, a viral infection which is so common in children. Malaria, dengue fever, the child could be on certain medications like anticonvulsants. Rarely something called as ITP, which is immune thrombocytopenia. These are the reasons for low platelet counts. In addition, the biggest worry for all patients is it cancer? Rarely, yes, but by and large, it is the last on the list. But before we proceed, why all this fuss about platelets? What are platelets? What do they do? With the help of Mr. Platy, let me explain to you. So Mr. Platy with his friends, those are the other platelets, they all run to the site of injury or a surgery. They coat the blood vessel and with the help of even more friends or more Mr. Platys, they form a clot. Of course, this clot is aided further with the help of clotting factors, and this prevents or this seals the gap and prevents further bleeding from happening. However, when the platelet count is low, the bleeding continues. So the role of the platelet is to basically prevent bleeding or prevent excessive bleeding. If you want to know more about blood and platelets, please watch our video on what is blood. So when should you really be concerned about a low platelet count? If the platelet count lasts for a prolonged period of time, or if the platelet count is very low, like sometimes we have patients coming in at 10,000, 15,000. More than the count, it is also the associated symptoms. That means if there is a bleeding in the skin in the form of tiny dots, there's bleeding from the nose, bleeding from the gums, in the urine or in the stool, or if there are very large skin pleats with very tiny injuries or small injuries, then one must definitely be worried. If there is fever, the child is unwell, irritable, looking sick, then also you should be worried. Sometimes children have lymph nodes which are swelling in the neck, in the armpits, in the groin and other areas. Or if the abdomen looks very big because of a large liver or spleen, in all these conditions you must be worried and you should consult your pediatric hematologist-oncologist for further tests. What are the other tests that the doctor is likely to advise? So first and foremost, we would repeat the CBC and make sure that the platelet count is indeed low. A peripheral smear to make sure that there are no abnormal or cancer cells in the blood. In addition, bone marrow and other tests will also be advised. For more information regarding bone marrow, we have a video as well, so you can see that. So what should you as a parent actually be doing? 1. Don't panic. 2. If you see any of the red flag signs, visit your hematologist-oncologist immediately. 3. Do not stop or start any medications without the advice of your doctor. And 4. You need patience sometimes for the counts to recover, and you may be advised to just wait and watch. Thank you friends for watching this video. I hope it was useful. This is an educational initiative. It cannot replace the consultation of your doctor. So please make sure that you visit your doctor at all times. Thank you.